Hello friends, I am Dr. Radhika Kopikar, Medical Head, Kopikar Dermatology Skin Hair Laser Clinic in Vikhroli East, Mumbai. Today we are here to discuss about dry skin, and in the end I would like to add certain procedures that we do in our clinic for patients with dry skin. So do stick till the end of this video. Your skin consists of three layers: the epidermis, dermis and the hypodermis. Epidermis is the outermost layer of your skin, which is a waterproof barrier and gives your skin its color. The dermis is beneath the epidermis and is consisting of the connective tissue, which includes your blood vessels, your sweat glands, your hair follicles, etc. And then comes the hypodermis. This is a subcutaneous tissue layer which consists of fat and other connective tissues. Now let's come to the types of the skin. So many people are confused about what type of skin do they have. So there are broadly about 5 categories: normal skin type, dry skin type, oily skin type, a combination skin type and sensitive skin type. For identifying the type of your skin, you can wash your face with a mild cleanser, wait for an hour. So if after washing your face and waiting for an hour, your skin appears normal in the mirror and to touch it is just alright, then that's a normal skin type. The oily skin type will appear pores, and you may also have blackheads and whiteheads. To touch, it will feel sticky or oily. The dry skin type, to look, will appear a little flaky or slightly whitish, and to touch you will feel that it is dry or rough. The most common skin type which we encounter is a combination skin type, in which the T-zone, that is the forehead, the nose and the chin, will appear shiny and oily, and the rest of the face, that is mainly your cheeks, will appear normal. And lastly, the sensitive skin type is one which will be reactive. It can appear red sometimes due to some product applications. Patients complain of itching and burning sensations to products that they apply on the skin, or just when they move out in the sun or after washing their face. So this is a sensitive skin type, and here you need to be very careful about what you apply to the skin, and pat it dry after washing, and be very careful about the products that you use. Dry skin is a very common disorder, and more so in this winter season. Dry skin can happen at any stage and due to many reasons. Dry skin often appears as irritated patches or dry rashes on your body. Extremely dry skin is a warning sign for a skin condition called dermatitis. It can lead to itchy rash or dry, irritated patches of skin. Earlier it is diagnosed, better it is. Without treatment, dermatitis often gets worse. People with dry skin can have a variety of symptoms like rough, scaly, flaky skin. They can be itching. There can be a grey ashy appearance in people with darker skin types. Your skin may look cracked and may also bleed. You may have chapped or cracked lips. Anybody can have dry skin. Skin becomes dry when it loses too much water or oil. But some people are more prone for dryness. Many people in their late 40s or 50s come and tell me that, "Doctor, I never had a dry skin problem. Why do I have it now?" So that is because as we age, our skin tends to become thinner and drier. So in our 40s, most people need to use a very good moisturizer every day. Second is people in jobs like nursing or hairstyling, or where they have to immerse their skin in water for long hours. There too the skin can become dry and cracked and raw. Then people who swim, so certain swimming pools also have a very high content of chlorine, which can then lead to dry skin. People living in very dry climatic conditions like in the desert or in the mountains also tend to have dry skin. And lastly, certain skin diseases, like if you had atopic dermatitis as a child, you are more prone to have dry skin as an adult. Another skin disease called psoriasis also leads to extremely dry skin. The best treatment for dry skin is to moisturize. So apply a moisturizer frequently throughout the day. It will help in keeping your skin soft, supple, and will avoid getting cracks. The best time to apply your moisturizer is when you're just out of the shower and after pat drying your skin, when your skin is still a little wet. It helps in locking in the moisture and maintaining hydration for long hours. Body lotions or moisturizers are available in various types like ointments, creams, lotions and oils. your dermatologist will be a good person in guiding you as to which moisturizer will suit your skin type the best. You also may need to do a little changes to your lifestyle, like if you have a habit of scrubbing your body, you may need to avoid this because this leads to further drying of skin. And second, if you have dry skin, you should be avoiding using any herbal packs or home remedies, as this can irritate your skin. And thirdly, if you are using detergents and washing clothes or utensils, it is best to use gloves so that you protect your hands while you still continue to do your chores. Coming to do's and don'ts for dry skin, the first thing is to avoid any kind of an allergen. 35% of people suffering with eczema tend to have food allergies, so you must know what kicks your eczema and avoid those food items. Dust, pollen and pet dander can also be the culprits. You must also pay attention to the clothes that you're wearing. Nylon and heavy synthetic fabrics can itch and scratch your skin, leading to irritation. You must also avoid woolen clothes. Try to wear organic clothes containing 100% pure cotton. Always use lukewarm or cold water for your bath. Avoid hot baths. Avoid using scented or fragranced products in your body lotions or your soap or your detergent. Always try to use mild, dye-free, unscented products for your skin. The last thing is stress. If adults or children are under stress, the skin shows it. So try not to get too stressed about things, because this can again lead to scratching and itching. Don't ignore infections. Skin with eczema or dryness is more prone for bacterial and viral infections. So keep an eye for infections. Look for signs of redness, pus or boils. Get it treated early to avoid any further complications. My last point is going to be interesting for many, as I feel many people don't know about this. Hand sanitizers, which are very frequently used nowadays, which are basically waterless antibacterial cleansers, are not good for dry skin people. It can irritate your skin and again lead to eczemas. It is always best to wash your hands with water, pat it dry and immediately apply a moisturizer to avoid any kind of hand eczemas. After discussing in detail about dryness of skin and why it happens, do's and don'ts, here we are discussing about certain treatments that can be safely administered to people with dry facial skin. I know patients with dry skin can have patchiness or pigmentation or even scars, or they may just want to pep up their skin. So here are my 4 favorite treatments for people with dry skin. Number 1 is Oxy Hydra Facial. This is a very soothing, calming, oxygen infusing treatment which our patients love, and it can just pep up your skin and give you a boost. The second favorite of mine is a Skin Booster Injection. This is a hyaluronic acid containing injection which gives deep hydration, glow and smoothens out the fine lines and patchiness on your skin. Third is a micro needling procedure or a micro needling with RF procedure. This works well and wonderfully for deep scars. And fourth is a growth factor concentrate injection, which is the latest in the market today. And it is basically using your blood. We create growth factors which are autologous, meaning from your own blood, and this can be used to give growth to various connective tissue structures inside your skin, reviving your skin, making it more youthful and smooth. I hope this video was useful to you. If you liked it, do like the video, subscribe to our channel, share it, and all the other links to my other social media handles you will find in the description box below.